You're welcome to another episode of Fertility Talk with Olarunke Thaddeus. On this week's episode, I will be discussing why it is very important to evaluate your endometrial cavity before you start your IVF. So what is endometrial cavity? Your endometrial cavity is the inside of your womb. In fact, it is the base where embryos would implant. Okay, so why is it very important to check your womb before we begin your IVF treatment, or even before you start getting pregnant? Okay, we all understand that every woman has a womb, and it is paramount to the process of conception. Without the womb, no one can get pregnant. It is said that the only purpose of the womb is to carry pregnancy, and once you're done making babies, then the womb is no longer important. It has already served its purpose. Okay, and in some parts of the countries, places like South Africa, having a total womb removal is one form of contraception, especially the moment you're done with childbearing. So thus it is said that the womb is not important for survival except for conception, that is producing one's offspring. When the womb has issues, then getting pregnant will be very difficult. Okay, let me just go through some of the issues that could affect the womb. One of such issues is uterine fibroid. I've discussed uterine fibroid before. You can watch our other videos. Other issues are intrauterine adhesion, endometrial polyps, abnormalities such as septum and double uterine cavity. You know, all these are issues that could affect your uterus and thereby making conception very difficult. Okay, uterine adhesion, for instance, is commonly acquired via infection such as tuberculosis and uterine procedure such as overzealous dilatation and curettage. Also abdominal myomectomies and cesarean deliveries. All these are causes or possible causes of adhesion, uterine adhesion. Okay, so there are various ways you can evaluate your womb, and one of the most common ways to evaluate your womb is the use of ultrasound. And in this part of the world, ultrasound is the most commonly used method to evaluate one's womb. Okay, so the ultrasound can show the shape of your uterus, whether your uterus is normal or globular, as seen in the case of women that has adenomyosis. Scan can also show the size of your uterus, whether it is normal or bulky, when there is fibroid in there, or adenomyosis or hypoplastic resulting from ovarian failure. Yeah, it can also see the orientation of the uterus, whether it is anteverted or retroverted. It can also reveal the echo texture of your uterus, whether uniform or homogeneous or heterogeneous, as seen in cases of womb that has fibroid. From the scan, from ultrasound, you can also you can also discover if your uterus is distorted, if the lining is distorted, if the cavity is distorted, or the thickness of the endometrium. It can also show the endometrial pathologies such as endometrial polyps and the uterine adhesion that I have discussed above. It can also show your ovaries. Okay, other findings an ultrasound can reveal if there is a case of swollen fallopian tube known as hydrosalpinx, presence of fluid in the pouch of Douglas, referred to as pelvic inflammatory diseases, and of course endometriosis also can be detected through your ultrasound, especially after your menstrual flow. Ultrasound can also help to identify your ovaries. It can help to see your follicles, and of course ovarian pathologies such as the different form of cysts endometrioma, dermoid cyst, and polycystic ovary. Yes, ultrasound can seek or reveal all this. Okay. Other method of evaluating the uterus is through the use of X-ray. So you do the X-ray for the womb, known as hysterosaphigogram. Yeah, HSG. HSG will entail passage of water, yeah, to the cavity. The advantage of HSG over the usual ultrasound is that it can discover if your tubes are patent or if they are blocked. Okay, but the only disadvantage to this method of evaluation is that it is a very painful method of evaluating the womb. As a matter of fact, between me and you, is a very, very painful procedure. Okay. So no, hysterosaphigogram is also another method of evaluating your uterus. It also entails passing the fluid, commonly known as normal line, into the cavity so as to distend the endometrial cavity and observing this fluid under ultrasound, you know. So ultrasound, as it is an improvement over straightforward ultrasound, as it is better defines intrauterine pathologies such as submucous fibroid and polyps, and also highlights tuber patency. Another procedure or another method that you can use or one can use to evaluate the womb, your endometrial lining or cavity, is hysteroscopy. Okay, through the use of hysteroscope, you know, the scope is passed through your vagina into your womb. With this procedure, your doctor can actually assess the inside of your womb to know whether you have fibroid or polyps, or if there are adhesion in there. And the beautiful thing about this procedure is that it can be diagnostic, that is just going in to see what is in there, or operative, that is if your doctor observe there are issues there, then of course it can convert diagnostic to operative to help you remove the polyps, small fibroids, straighten those adhesion, you know. So that's the beautiful thing about hysteroscopy. So I love so much and recommend for all our patients. And I know that also there is a controversy around hysteroscopy, whether it is important to do hysteroscopy before IVF or after IVF. I am always of the opinion that it is very, very important to do a thorough evaluation before you begin your IVF process. Okay, I don't believe in death or medicine after that. I don't believe in that. Okay, some places would wait for IVF to fail before recommending hysteroscopy. I believe hysteroscopy should come first, so that if there are issues that needs to be sorted out, then that can be done. So thank you for watching today's episode of Fertility Talk with Olarunke Thaddeus. For more enquiries, kindly comment below, and if you want to see us for consultation, kindly call the number showing on your screen. Don't forget to subscribe to our YouTube channel and kindly share this video, please. God bless.